They've renovated this beautiful room as well as our KMC area and the breastfeeding room. So those are 3 beautiful areas in our hospital where patients directly have benefited.
The patients have been, parents have been mostly impacted, and that's largely through, multiple ways through the organization. So firstly, the creation of the counseling room just creates a better experience and environment for parents to receive difficult news.
There's so many things that Footprints for Sam has come to our aid. Our hospital is government-based. She's old. The infrastructure is falling apart. And government has not come in to help us. But Footprints for Sam, and I can start from the little things like food parcels, and just recently when we didn't have water and toilets, suddenly there was water and toilets and we could work for 24 hours, and in a system where everybody else lets you down, I just had to, it was a small message and it was done. And there was water and toilets, something that we take for granted. It just happened.
You just have to look around this room, and there have been 3 areas that Footprints for Sam have been involved with in our hospital.
For the hospital, we've been lucky thanks to Sam. We have 3 rooms. We have a breastfeeding room now for our moms, which has brought back dignity to our moms, because otherwise they were expressing in the corridors.
Our breast milk room. That room has provided so much of dignity to our mothers. They used to sit in this old shabby room, like 5 to 6 of them in this room, exposed. We would open the door, go take out milk, no privacy, no dignity. Now we have this beautiful breast milk room.
For the hospital, you can see the impact that they've made on the hospital everywhere. From this room where we're doing the interview in, this room is used so frequently to create a better experience for parents who are grieving or receiving difficult news.
This space, this has been my space. I don't mean it like my space.
And we have this beautiful counseling room which has given dignity to so many patients, because we can bring them here, we can talk privately, they can spend time with their babies that have already gone to heaven. They can have that privacy which we never had before.
And if you walked into our NICU and to our neonatal unit, if we had to counsel a parent, it was done at the bedside, if we were lucky. There's no chairs for the parent to sit in, then we're all scrambling to get a chair. There's no privacy there. If a child was about to pass away or passed away, there was nowhere for these parents to hold their child, nowhere private to spend moments, their last moments with these babies. We used to put a white screen in the neonatal ICU, and everybody knew around what was going on, but still there's this noise, and it just wasn't a good place to grieve in. And then Footprints for Sam gave us this room, and it just changed everything. The whole setting just changed it. The parents come here, they sit. Sorry, I'm not good at this.
I feel like this room has brought the personal factor in, it's brought closure, it's just brought dignity back to patient care.
And it's so much better. Even I'm crying, I don't cry. I don't cry. And for me personally, when I walk in the room, I always know, if I turn to my left, I see Sam and I see his dad Fred. And I look at them and I take a moment to breathe, and then I remember Melissa, his mom, and all the words she said, the things that affected her when doctors spoke to them. And it makes me conscientious of what I'm going to say to the parent. I always take that moment just to glance at Sam and remember, this is somebody's child, this is a family that we have to look to. So personally, I feel this place has helped, this room has helped me grow to communicate better with my patients and their parents.
We have a lovely counseling room that we use not only for our moms, patients, sometimes for us when we're having our low moments, for staff. Like today I just had a nurse who was not having a good day. We sat and had a chat and she felt better afterwards.
Then we got our KMC unit and we were all so excited. I can't tell you, we had a KMC unit, we had 12 beds. There wasn't even hot water for the moms. They used to bathe in cold water. There was no microwave for their food to be heated. And then we suddenly have this beautiful room. It takes 18 mothers. It's literally a home away from a home. And for the community that we serve, this home is actually better than some of their own homes.
And lastly, our biggest one, which is the Kangaroo Mother Care Unit, which our mothers love. And we used to struggle with our moms going to KMC, but now when they see it, you can see they light up and they don't mind going back to KMC. So thanks to Sam.
As well as KMC, I have to say this, moms have told me many, many times that KMC feels like a home. It doesn't feel like a hospital ward. And this is just the beauty of what Footprints for Sam has done in our hospital.
And then the transport and food packages have improved their lives, as well as the Kangaroo Mother Care. That is such a beautiful environment to be doing something as wonderful as kangarooing. So it really just normalizes that environment and makes it a lot more homely than what it was before. So I think those are the biggest impacts.
The new KMC, which is beautiful, and the mums love it, and so does the staff. Then we have the breastfeeding room where the mothers go and express milk and bond with each other and share their journeys.
And the breastfeeding room particularly has become a place where moms can talk to each other, step out of the hospital environment, just be with each other and bounce off ideas of each other and just have that time away from the hospital setting.
In so many ways, it's been such a positive influence from our KMC to this room, to the care packages that we have. It's just given us a new way to connect with patients, where we can be kinder to them, more giving, and come into this safe space where we can really just talk to them freely about so many issues that are so important.
And it's a motivating thing. So watching the environment improve around you, making the load slightly lighter, makes you want to stay, makes you want to continue contributing, and makes you want to continue in public service.